tingling, burning, numbness, or feeling like you're walking on broken glass. Does that sound familiar? If it does, you're not alone. 1 in 4 people over the age of 70 lives with this condition. It's called peripheral neuropathy. And here's the thing most people get wrong. They look for a pill. But researchers at the University of Utah proved something remarkable. They showed that the right exercises don't just manage symptoms, they actually regrow nerve fibers. They could see it under a microscope on skin biopsies taken before and after an exercise program. Today, I'm going to show you 6 simple home exercises that do exactly that. You don't need a gym. You don't need special equipment. All you need is a sturdy chair and 15 minutes a day. Let's start with a quick understanding of what's happening inside your body. Your peripheral nerves are like electrical cables running from your spinal cord all the way down to your feet and toes. They carry important signals, pain, temperature, and the sense of where your body is in space, what scientists call proprioception. When those cables get damaged, the signal gets scrambled. Your brain starts receiving noise instead of clear information. That's where the burning, the tingling, and the numbness come from. It's not all in your head. It's a physical breakdown of those nerve fibers. So, what causes this damage? The number one cause is diabetes. It's behind roughly 40% of all neuropathy cases. High blood sugar literally glues nerve proteins together through a process called glycation. Think of it as sticky sugar crystals jamming up the wires. But diabetes isn't the only culprit. Alcohol directly poisons nerve fibers and blocks the absorption of vitamin B1, which is essential for nerve health. Low vitamin B12, especially if you take metformin for diabetes or omeprazole for acid reflux, is another major cause. Chemotherapy, autoimmune diseases, obesity, and even certain infections can trigger neuropathy as well. And here's an uncomfortable truth. In about 30% of cases, doctors never find a specific cause at all. That's called idiopathic neuropathy. Now let's talk about supplements. I'll keep this short and practical. The supplement with the strongest evidence is alpha-lipoic acid. A series of clinical trials called the Sydney and Nathan studies tested it on hundreds of patients. They found that 600 milligrams a day reduced pain and tingling by 30 to 50%. That's significant. Next, vitamin B12. Don't just guess. Get your levels checked. This is especially important if you're on metformin, because metformin depletes B12 over time. And here's one that surprises most people. Vitamin B6. In doses above 50 milligrams a day, B6 actually causes neuropathy. Yes, the same vitamin that's essential for health can become toxic to your nerves at high doses. So check your multivitamin and any B-complex supplements. Make sure you're not exceeding 50 milligrams of B6 daily. All the research links are in the description below. But supplements alone won't regrow nerves. That brings us to the real reason you're here, the exercises. In 2015, scientists at the University of Utah took skin biopsies from neuropathy patients before and after an exercise program. After several months, they took another biopsy. The nerve fibers had started growing back. Not felt a little better. Not seemed to improve. Actual new nerve endings in the skin visible under a microscope. Which exercises caused that regrowth? I'm about to show you. We have 6 exercises, divided into 3 groups: cardio, balance, and footwork, all done at home, all with a chair. Part 1. Cardio, the foundation. Cardio is what triggered nerve regrowth in that Singleton study. Without it, the other exercises give you much less benefit. The goal is a 150 minutes per week of moderate cardio, walking, a stationary bike, swimming, whatever works for you and feels comfortable. But I want to show you one cardio exercise you can do at home without stepping outside. This is especially useful when the weather is bad or when you don't feel steady on your feet. Exercise 1. Seated march. Sit on a sturdy chair. Keep your back straight. Don't lean into the backrest. Start lifting your knees one at a time, like you're marching in place. Add your arms. Swing the opposite arm forward with each step. The pace should make your breathing pick up a little, but you should still be able to carry on a conversation. Start with 3 minutes. Add 1 minute every few days. Your goal is 10 to 15 minutes per session, twice a day. That gives you 20 to 30 minutes of cardio daily, and your risk of falling? 0. Part 2. Balance. Preventing the fall. Cardio gets the healing started, but here's the problem. Damaged nerves have trouble sensing where your feet are. That's the #1 reason people with neuropathy fall. The next 2 exercises could literally save you from a broken hip. Neuropathy messes with proprioception, your body's sense of where it is in space. You can't feel the floor under your feet as well as you used to. Your brain doesn't get enough information to correct your balance in time. The result? Falls. And for someone over 60, a fall often means a fracture, surgery, and months of lost mobility. Exercise 2. Single leg stand. Stand behind a chair with both hands on the back of it. Shift your weight onto your right foot. Lift your left foot just slightly, barely an inch off the floor. That's it. Hold. The goal is 30 seconds on each leg, but if you can only manage 5 seconds right now, that's perfectly fine. Start there. Do 3 rounds on each side. When 30 seconds gets easy, take one hand off the chair, then both hands, and when that feels comfortable, close your eyes. Closing your eyes is where the magic happens. You take away your visual safety net. Your body is forced to rely on exactly those nerve pathways that are damaged, and they start working harder. It's like making a weak muscle lift weight. It's tough, but it gets stronger. Don't rush it. You'll notice a difference within 2 weeks of daily practice. Exercise 3. Heel-to-toe rocks. Stand with your feet shoulder-width apart, one hand on the chair. Slowly shift your weight back onto your heels. Your toes come up just slightly. Hold for a second. Then smoothly roll forward onto your toes. Your heels lift off the floor. Hold. Then roll back down. 15 repetitions. 2 sets. Keep the pace slow. This isn't about speed, it's about control. Every single rock sends a signal from your feet to your brain. I'm here. I can feel the floor. I'm in control. This exercise trains your balance, strengthens your calf muscles, and stimulates the sensory receptors in the soles of your feet. 3 for the price of 1. These 2 balance exercises take about 5 minutes. Do them every day, in the morning while the coffee is brewing. Part 3. Footwork. Waking up the nerves. Balance protects you from falls. But there's something else going on with neuropathy. The small muscles in your feet are quietly wasting away. The motor nerves have stopped talking to them. The next 3 exercises literally wake up the nerve endings in your feet. Exercise 4. Calf raises at a chair stand, holding the back of a chair. Slowly rise up onto your toes. Count 1, 2 at the top, then slowly lower back down, counting 1, 2 at the bottom. Don't let your heels drop. Lower them gently. 12 repetitions, 2 sets. Rest 30 seconds between sets. Why does this matter for neuropathy? 2 reasons. First, you're strengthening your calf muscles, which act like a pump. When they contract, they push blood up through your veins. When they relax, fresh blood flows down to your feet. More blood means more oxygen for your nerves. Second, every rise and drop sends a proprioceptive signal from your feet through your spinal cord to your brain. You're training the entire nerve pathway from sole to skull. When 12 reps feel easy, try it on one leg. That's a big step up, so don't rush. Exercise 5. Towel scrunch. Sit in a chair. Lay a thin towel flat on the floor in front of you. Place your bare foot on the edge of it. Now, using only your toes, scrunch the towel toward you. Spread your toes. Grab the fabric. Squeeze and pull. Spread, grab, squeeze, pull. Do this 10 times on each foot. 2 sets. At first, it'll feel like your toes aren't listening. That's completely normal. That feeling is actually the point. You're activating nerve muscle pathways that haven't been used in a long time. Every session, it gets a little easier. Your brain is literally relearning how to control these muscles through whatever nerve fibers are still working. Want to make it harder? Instead of a towel, pick up small objects with your toes. Marbles, pencils, coins? Move them from one pile to another. That's fine motor control for your feet. Exercise 6. Ankle circles and the alphabet. Sit down. Lift one foot slightly off the floor. Rotate your foot in a circle. 10 times one way, 10 times the other. Slowly, with as much range of motion as you can. Feel the ankle joint moving through its full range. Now, the fun part. With the tip of your big toe, write the letters of the alphabet in the air. A, B, C. Take your time. Each letter is a different path that works the muscles of your lower leg and foot from a different angle. Putting it all together, your 15-minute daily routine. Part 1. Warm-up. Seated march for 5 to 10 minutes. That's your cardio base. Part 2. Balance. Single leg stand, 30 seconds each side, 3 rounds. Heel to toe rocks, 15 reps, 2 sets, about 4 minutes total. Part 3. Feet. Calf raises, 12 reps, 2 sets. Towel scrunches, 10 per foot. Ankle circles or alphabet, 10 each way per foot. About 5 minutes total. Whenever you can and the weather is nice, add a 20 to 30-minute walk outside. That adds to the benefit but doesn't replace your home routine. 3 rules that make this work. First, start at half. If it says 12 reps, do 6. If it says 30 seconds, start with 10. Nerves don't like being shocked. They like gradual progression. Add a little more each week. Second, do it every single day. Consistency beats intensity. 15 minutes daily is better than an hour once a week. Nerves heal slowly, but steady effort keeps the process going. Third, check your feet after every session. Look for blisters, red spots, or small cuts. When you can't feel pain, damage can happen without you knowing. 1 minute of looking keeps you safe. Science has shown that nerves can regrow. We're not guessing here. This isn't hype, and it's not just a nice idea. It's something real. And that's exactly why these 6 exercises matter, because all it takes is a chair, 15 minutes a day, and doing them consistently. On top of that, get your B12 and blood sugar checked. Ask your doctor about alpha lipoic acid. Eat fish and greens. Cut the sugar and trans fats. Neuropathy is not a death sentence. It's a challenge. And now you have a plan to meet it. If this video helped you, hit that like button. It helps other people find this information. Subscribe if you want more breakdowns like this. And drop a comment. Which of the 6 exercises are you going to try first? I read every single one. And please, talk to your doctor before you start, especially if you have foot ulcers, severe loss of feeling, or serious balance problems. All the scientific sources are in the description below. Take care of those feet. They've carried you this far.